Hi, thank you, Carolina. Hello, I'm Nazni from the Institute for Medical Research. I'm R. The Medical Entomology Unit is a WHO collaborating center for taxonomy and vectors of public health. And recently, our lab has also been accredited as a GLP lab by the local authority as well as WHO. We are one of the six lab in Asia who has been accredited for GLP. My. Okay, vector-borne diseases is a burden in human population for centuries. And we have in Asia, dengue, Zika, chikungunya, malaria, filariasis. We do not have yellow fever anyway in Asia. That's something good for us. And we have other diseases as well carried by these vectors. And the important mosquitoes in Asia are the Mansonia, Anopheles, Culex, Aedes, and Armigerris. And currently, dengue burden is more prominent than malaria in Asia. As you can see in this slide, which has been published on 7 January 2022, the burden is in India, in the Mekong region, in the Philippines, in Indonesia, as well as in Malaysia and Singapore. So it's very difficult to kill this vector. You need a lot of resources to make sure that this vector is being controlled. The key vector for dengue is Aedes aegypti as well as Aedes albopictus in Asia. And there's another one vector known as Aedes niveus group, which dwells on the canopy and is able to transmit all the 4 dengue serotypes and is responsible for salvitic transmission. Traveling by air is one of the reasons the spread of dengue in Asia. Now or today, you can travel within a day to any of these countries. There's a publication which states that, which has reviewed 59 years of data from 20 countries in Asia, and it has confirmed that dengue serotype 1, 2, and 3 is linked to air travel in Asia. Do you know that mosquito kills more human than man killing man? Okay, Aedes aegypti and Aedes albopictus gained popularity during the Zika outbreak. And WHO has mentioned in one of their themes in 2014, small bite, big threat. The key issues to control dengue is there's no specific antiviral, there's no effective vaccine. Current strategy for prevention is community-based integrated mosquito control. Excuse me. And the most important point is as low as 2 to 3 female Aedes aegypti emerging every day in a locality of 100 people is sufficient for dengue transmission. The overall problem to control these vectors, we have been using the chemical insecticide, the biological insecticides, and environmental management techniques. However, the overall problem, it remains very challenging. In Asian countries, in most of the Asian countries, if there's a dengue case, thermal fogging and the ULV truck mounted is being used. However, in Singapore, it is preventive, whereby there is a routine fogging taking place. When a single case is reported for dengue, thermal fogging at 200-meter radius is being used. But if there's a dengue outbreak, thermal fogging, truck-mounted ULV using the same insecticides are being used and is being repeated for 7 to 10 days later. Cost estimation of current dengue control measures in Malaysia in a 4 district, which is hotspot, is 22.4 billion, which is equivalent to US 5 million. And for information, in Malaysia, we have got 100 of districts and we have got 100 of hotspots. This indicates that it's controlling dengue is not chicken feed. The DDG of the Ministry of Health said that ideal dengue vector control tool needs to be scientifically proven, affordable, and sustainable. And chemical pesticides has been used for vector control for at least 80 years. This is one of the figures where I'm showing you when the organic compound has been come into the world, which is DDT in 1940, and now in until etopenfrox, which is one of the recent, and I think there is two more recent compounds which has been brought into, which is Fludora fusion, and there's one more, I can't remember the name, but there's another compound for vector control. The annual insecticide usage by region is shown in this table, but I would like to bring attention to Southeast Asia, where it's using the huge amount of insecticide. From in the year 2000 to 2009, you can see that organochlorine is the insecticide most used, followed by organophosphate. However, in the year 2010 to 2019, there is a reduction of usage of organochlorine and all the other insecticides. This could be due to the resistance development to some of the active ingredients, and moreover, it could be due to the introduction of other insecticides, alternative insecticides such as the bacterial larvicides, IGR, and spinosins. This table shows you the burden of insecticide usage in terms of diseases. So, malaria has been using the most amount of insecticide, which is 3,000 over metric ton, followed by dengue. But you can see again that in malaria, organochlorine is mainly used. However, in dengue, we do not use organochlorine. And the amount of insecticide used for malaria is 3 times more than insecticide used for dengue control. Insecticides has been used in agricultural pests as well as public health pests, and this has caused the resistance development. Truth hurts, but lies can kill. So under and overdosing, bad spray coverage, extended spraying intervals of pesticides on a large scale of insect vector and agricultural pest control has led to resistant development in public health vectors. Resistance is not restricted to one or the other life stage. A population may become resistant when its LC50 has increased by 10 times. And the larval test is more sensitive than the adult test in detecting changes in susceptibility level, whereby if there is a 10-time increase in LC50 to an insecticide, is equivalent to an increase of 2-fold increase in adults. This is a table which I have taken from Bharti et al. 2021, where she has done a systematic review on the global insecticide resistance mechanism. But I have selected only those countries which is those countries from Asia, and I have summarized the Aedes aegypti here for a clearer picture. As you can see from this table, there are 14 active ingredients, and India is resistant to 10 of the active ingredients, and Malaysia is resistant to the 10 of the active ingredients. And the active ingredient which is most resistant is Temiphos, which is a larvicide, followed by malathion, permethrin, then comes lambda cyhalothrin. This is for Aedes aegypti, and you can see that even though we have never used DDT for our Aedes aegypti control, but is already naturally resistant. And this is a table for Aedes albopictus, which I have summarized for the Asian countries. And again here, you can see that among the 13 insecticide used, in India, 9 of insecticide out of 13 already been resistant. And similarly in Malaysia, 9 of the AIs are already resistant. Again, Temiforce seems to be the most resistant larvicide in most of the countries, and followed by Malathion, Permethrin, and Lambda cyhalothrin. The resistance, I've shown you that Aedes aegypti and Aedes albopictus is already resistant to most of the insecticides. But we have also done screening on Culex quinqui fasciatus, which is already resistant to Malathion, Penetrathion, and Permethrin. Anopheles maculatus, which is a vector for malaria, is still susceptible to most of the insecticides. This is where I am from, Institute for Medical Research. It has been established in 1900, whereby the purpose was to conduct studies on vectors of malaria as well as the diseases, which is malaria. And now the malaria due to Plasmodium falciparum has faded. So the most important disease, the malaria disease now is the simian malaria, which is quite alarming and causing quite a number of deaths. But the institute has also focused its research to controlling dengue vectors. The institute also monitors in the hotspot locality, and monitoring resistance is very important, and insecticides are being used, and that change in insecticide policy are based on sound scientific data. This is a table where I would like to share with you because it has got some interesting results here. Is the knockdown resistance status of field strains Aedes aegypti adults exposed to 0.75% permethrin. I would like to show you that this locality, which I've highlighted here, which is 26.57-fold resistance to KDR, and this another locality which is nearby 50 kilometers away, and it is 598 folds resistant. The resistance mechanism involved here is due to KDR mutation, and it could be 2 different KDR mutation involved. In IMR, we also evaluate insecticide in an operational setting. If there is a continuous increase in dengue cases in the hotspot locality, even after 2 cycles of adulticidal spraying, MOH will request IMR to evaluate the efficacy of the insecticide used in that area. So what we will do in IMR is that, first of all, we will do the we will use the WHO bioassay testing, just using the lab strain and field strain to see if there is resistance development. Then we will do field evaluation by using cylindrical cages by WHO, and we will put the mosquitoes, the field collected mosquitoes, which is F1 generation, which is very similar to the wild type mosquitoes, in these cylindrical cages, and which is being placed in the living room, in the bedroom, and in the kitchens. And you can see these cages here with mosquitoes. So this the operational data shows that resistance has developed to the commercial formulation, and is more evident in ULV spraying than the thermal fogging. It's very clear here. This is thermal fogging. The mortality is around 60% and below. But if you see the ULV spray, you can see that the mortality is below 20%. So you can see that there is a resistant development, because when you see the lab strain here is 100% kill, and this is another strain from rural where there's less exposure, is still almost 100% kill. But in the ULV, but you use the ULV strain, is still the black strain has got high mortality compared to the field strain. This indicates that this particular commercial insecticide is already resistant to the field mosquitoes. However, if you see the Aedes albopictus, it's interesting to see that the same insecticide was effective to give a near 100% kill in the field Aedes albopictus. It's very clear here. It's almost 100%, and over here is almost 100%. So therefore, this shows that this particular commercial insecticide is already resistant to Aedes aegypti, but not Aedes albopictus. So what's next? If this happens, what the ministry will do is the ministry will relocate this insecticide to areas where less insecticide are being used, and it will be used for controlling nuisance mosquitoes. And in this area where the resistance has occurred, another kind of insecticide with different mode of mechanism will be used. Resistance surveillance is crucial in providing baseline data for control program and pesticide selection. Early detection of resistance in mosquitoes populations helps in preventing failure in disease control and management. In the IMR, we have developed a rapid resistance detection kit, which we can screen resistance in the field rapidly. We have developed a kit for oxidase, for esterases, as well as for acetylcholine esterase. This kit has been patented in several countries. This is very easy to use this kit because it has got color code, which indicates highly susceptible, moderate resistance, and highly resistant. Same thing is for oxidase and as for acetylcholine esterase. So the test procedure is very simple. You just homogenize insect, which is single mosquitoes, add substrate, add indicator, and read the color code. And by using this in the field, you can very fast, you know whether the percentage of your mosquito population is resistant or is susceptible. This is an example from field collected mosquitoes, where you can see that in a field, the wild type mosquitoes, some of them are highly resistant. There are susceptible mosquitoes in the field, as you can see here and there are also heterozygous resistance, and these are all susceptible mosquitoes. This is for esterases, and for oxidases, you can see that there are highly resistant mosquitoes to oxidase. The mechanism is oxidase. Sorry, the mechanism involved is oxidase. And for acetylcholine esterase, if we use these kits, if it is yellow, it indicates that acetylcholine esterase is present. But if we use these are 4 replicates. This is another 4 replicates from the same mosquito. These are all single mosquitoes. And when we add propoxor in this wells, when we add propoxor, and if the color still remain yellow, it indicates that particular insecticide is not sensitive. It's no more. That means acetylcholine esterase is not sensitive. But if it inhibits, that means it's still sensitive. Okay, that means in this case, propoxor, when we use propoxor, it inhibits the color. So it's become clear. When it's become clear, it shows that the carbamate can still be used to control the mosquitoes. Resistance does not imply that it is impossible to control the resistance population or to prevent disease transmission, or that all population of this species cannot be controlled. Thus, a single report of resistance to an insecticide does not imply that an insecticide is no longer useful either within the local region or globally. I would like to emphasize here that lab data for resistance is not sufficient. You need to complement it with field evaluation in order to conclude and make decision and recommendation of the insecticide in question. With this, I thank you for your kind attention.